everybody, and welcome to another live stream with Co-Produce Care. I'm absolutely delighted to have fantastic guests again. We're going to be returning to the idea of, is it going to be the end of social care in 2025? Our last few guests, we had a few guests on Tuesday, we were talking about the challenges that people have. And they said it probably won't be, but it's going to be a really tough year. I know that there's a hashtag going around with Survive25 because of all of the challenges that we have from the budget, and also social care starting from quite a tricky place. But this live stream isn't just going to be doom and gloom. We are going to be looking at what we can do in the future, which is why I'm really excited to have a fantastic set of guests. So Carolina Gerlich from the Care Workers Charity, the CEO there, Simon Bottery from the King's Fund. We are hoping to also be joined by Rachel Jarvis, but she hasn't joined the stream just yet, but hopefully she'll pop on later. And Polly Robinson, who's an executive coach who can hopefully give care organisations some advice on dealing with some difficult times. So very excited to have my guests join me. If you are listening live, I know a lot of people do listen back afterwards. That's really where we get most of our viewership, is after the live stream. But if you are listening in live, and even if you are listening later, it goes in the comments. Just let us know where you're listening in from. Don't put all your details and address or anything like that. But it would be nice to see the spread of people who tune in. And throughout, please, we are encouraging people to get involved in the comments in the chat, because it's a really good idea to just find out what you can do with challenging times, how you can address them, but also ask our speakers some questions because they have given up their time for this today. So a few things I wanted to just highlight. I am going to be plugging this a little bit at most of the live streams, is a really exciting initiative that we've got coming up at Co-Produce Care. So you've hopefully heard on social media and heard me talking about before about our Each One Teach One Leadership Academy, where we're going to be supporting people who are maybe in a management position or a team leader position, or are starting their own micro organizations in social care, just going over the basics, but also helping each other with peer-to-peer mentoring on how to excel with recruitment, retention, and employment law. A lot happening in employment law in 2025. So please do try and engage with what we're doing there. One of the great ways to do that is check out the website, which you'll see in the chat, www.eachoneteachone.careleadership.com. And also, if you are interested in being on one of our first cohorts, we're doing a few sessions, training sessions, so starting from March, then you can also express an interest and get in there early, because we don't have that many places, and it's great to engage. So all of that should be in the chat. I've posted early. I got in there early before we started, so all that information should be there, but I will post again as we go along. And also, I am going to plug a few things for the Care Workers Charity. Obviously, we've got Carolina on today, but they're doing some really good things. And I think January is one of those months where people may be doing dry January or veganuary, and they just want something a bit positive to start their year off with. And they've got some really good events coming up that are just a bit of fun, really, but also help to raise awareness about the work they're doing and raise funds. One that's coming up shortly, which I'm sure Carolina will talk about later, is Brew Monday. And I like the idea of this because, of course, I think it's the third Monday of January is usually called Blue Monday. So there's usually a bit of a downer for everyone, and they're twisting that around and they're calling it Brew Monday. So if you've got a care organisation, or you want to get a few people together and sponsor the Care Workers Charity, everyone puts a few pounds together and sponsors them. Why not have everyone round, open your doors, invite family, friends over to your care home. Everyone has a brew, a cup of tea and a biscuit. Love a cup of tea and a biscuit. And make it a bit fun on what would have been Blue Monday, but they're turning it around to be Brew Monday. So super exciting. And they've also got lots of other events that they do throughout the year. So every month you have opportunities to get involved, and they are fun and they're challenging. So check them out. Again, I'm going to put that in the chat in a second, but let me know what you think. Is that something that you might get involved with? Challenge yourself. Okay, so without further ado, I'm going to get my guests in, and I know Simon's been having a few sound issues, but I'm going to pop you in, Simon, see if it works, and if it does, we'll go ahead. If not, we'll give it a bit more time. So Carolina, you're coming. This bit is a bit clunky of the process on StreamYard, I'm afraid. There we are. Okay, great. I think we've got everyone in. Okay, so welcome everyone. So today we're going to be talking obviously about the challenges in social care, but before we get into that, can you all just introduce yourselves to people who are watching? I'm going to start off with Carolina.
Good afternoon, everybody. Carolina Gerlich, CEO of the Care Workers Charity and a former care worker.
Great, thank you. Simon, I'm going to take you out for a second. And Polly, can you introduce yourself?
Hello, I'm Polly Robinson. I'm an executive coach and leadership development facilitator. So I work with organisations to develop kind of confident leaders and strong teams.
Great, excellent. So I think it'd be a good idea. We have had to lose Simon, I'm afraid, because his sound isn't cooperating. So which is good because we can really get into it. And Diane, I might bring you in a little bit as well. Carolina, 2025, there's a lot going on. There's the budget, of course, but care work has always been undervalued. Care workers, I posted on LinkedIn, are the lowest paid according to Indeed, and things might get a bit tricky going forward. What do you see from people that you know, that you speak to in your role as in the Care Workers Charity as the main challenges for the sector?
So in November, we held a round of roundtables. We had one exclusively with care workers, and then we had 4 with care workers and other stakeholders, looking mainly at the National Care Service and the Fair Pay Agreement and generally at the future of social care. And now, as we also have an advisory board of care workers and care workers champions, we get to speak to care workers very regularly about these topics. So I would say the main thing that always comes up, is pay and reward and other rewards for the work that care workers do. And they always say they really love their jobs and that it's an incredibly rewarding thing to be doing, but that the hourly pay, the lack of travel time being paid properly still, unpaid training hours, are still huge issues that care workers are facing, which means then they are struggling to pay for the very basic things in their life. A lot of care workers put applications in to our charity for financial support. We've supported over 12,000 care workers in the last few years. So yes, pay is number one. Another thing is training, quality of training, transferability of training, general professionalization of the workforce, including registration, a professional body. Those things that other professions have, but unfortunately care workers don't have access to, which has various consequences, and mostly it really doesn't give care workers any sense of belonging. And lastly, I would say is the kind of public perception, is the disrespect, looking down upon care workers. I think, that really shows in the pay rates, or that shows in the successive governments of the past really not acting properly on social care as well. And that is really difficult environment for care workers to be working in when they're trying very hard every day to support lives of other people.
It's a lot, really. Polly, I'm just going to take, because it's just the 3 of us now, I'm going to take you out for a bit and just get into it with Carolina, and then I'm going to pop you back in. So we will be coming to you in a sec. Just on the point of, just for anyone who doesn't know the kind of work that the Care Workers Charity does, how are you supporting care workers? And is there a trend in terms of the type of things that people are asking support for?
Yeah, so we support care workers financially in 2 different ways. So one is through our crisis grants or through local authority grants, but basically around financial hardship of care workers, where they're struggling to pay for their bills, for car MOT, or any kind of emergency expenses that they may have. That's when care workers can make an application to us for a non-repayable grant, and then we pay money into the bank for them to be able to pay for things. Secondly, we pay for care workers to be able to access mental health support in form of therapy. Most care workers do that online in their own time when it's flexible and convenient for them as well. And we also pay for some training of mental health first aiders. On top of all of that, we do a lot of advocacy work and trying to lobby for policy change, for increased funding to social care, for increased respect, recognition, professionalization of the workforce. Because like I mentioned before, all of those things really go together. Without respect and recognition, you won't have increased pay, but at the same time, it's a chicken and egg situation. Without increased pay, a lot of people won't respect care workers because it's such a lowly job. Therefore, people think it's unskilled and unimportant. And that couldn't be further away from the truth.
Absolutely. I think that's a really important point that you say, because it's almost like a self-fulfilling prophecy, because you're paying low, so the perception is then it must be valued we mustn't need to pay much, and then we still have a workforce, but I feel like it's almost taken advantage of there is a term and I can't remember what it is, but it's almost like the empathy that people have, it's almost taken advantage of that empathy.
Yeah.
And I feel that's definitely where we are as a society, and I might have to just mute you a second while I'm talking. There's a bit of feedback. I was talking to Isaac Samuels, and he was saying, what is the measure of the way that we value people and disabled people in our society if we aren't going to value them in the right way? So that's really worrying, I think. And obviously there's potential issues going forward. Obviously, a lot of people who are campaigning at the moment are providers worried about the viability of their business. So, by proximity, care workers being employed by those providers, there's a potential real issue for them and their jobs. But is that the case, or what are the worries for the care workers that you have specifically in 2025? Is it the similar worries around, when I have a job, or, is it actually quite positive because living wage is going up? So they're going to see more in their pocket if they are on national living wage. So be good to see from the care workers' perspective what you think might be the challenges or might not be the challenges for 2025.
So we discussed the whole pay thing with care workers at a roundtable in November, and they quite agreed that being paid anything around, minimum wage, living wage. Well, living wage is called living wage, but it's actually a minimum wage just for people of a certain age. It's not enough. It's not enough for the job that care workers do. And we discussed different amounts of money at the time, and some people agreed that minimum pay for care workers should be around £15. Some people are talking about £20-25. But what they also agreed on is that it has to be a realistic stepping stone, that it is affordable in terms of potential funding from the government, that it doesn't make the sector collapse and everybody lose their jobs. In the last couple of months, obviously, since the last budget announcement, I've been having a lot of conversations with care providers who are saying, the national insurance contribution increase is quite worrying, especially for those medium and small businesses. As SMEs are quite worried in terms of impact on their business, on their finances there. Some of the larger businesses I've spoken about said, they can just about make it. I think the problem is that I think the government still struggles to understand how diverse the sector is in terms of type of the business, type of the care provision and roles that care workers have as well. And that was, for me, very apparent in the announcement that Secretary of State Wes Streeting made, just after the new year, very unhelpfully, around delegated health tasks, because putting blood pressure checks with catheter care in the same sentence as if they're the same level interventions of support, I think that really shows how it is not understood what social care is, and what different tasks are. So for me, that's really the biggest challenge. It is the lack of understanding from the government still about social care. And then minimum wage, even though minimum wage is going up, it's still a minimum wage, and pay differentiation is really non-existent in our sector for most care workers. Some organizations introduce their own, but generally speaking, it is a few pennies between different levels, and that's unacceptable. So I just think that as other sectors work out what they're going to do, we're in post-pandemic recovery for me still, and other sectors are giving people better offers, and other countries actually are giving care workers better offers. We're going to struggle to get people into the sector, but most of all, we're going to struggle to keep people in the sector, because people can only give so much, and you have to give a lot when you work as a care worker, whilst they're worried about paying their bills and feeding the children.
This is a real salient point, actually. It's the real life issues and the real life suffering that people go through when they're trying to do a really good job. And they're actually incredibly skilled. If I think about the training that people have to go through, and the type of regulation that we're under, the CQC, it's the same regulator that regulates hospitals and dentistry and everything else, and it regulates care work. And if you look at the disparity between the terms and conditions of somebody who might work in the NHS and somebody who works in social care, I mean, it's huge. I mean, the sick pay for a start is just a massive difference, and I can't see there ever being parity between the two in that sense, but we could definitely campaign for at least something better, which is really important. So all the great work that Care Workers Charity does, the way forward now, what would you as a charity want to be focusing on? Obviously trying to get more people to support the charity so that when care workers are going through hardship, that there is somebody there for them, because that is specifically important to make sure we have people who stay in the sector. We shouldn't need the Care Workers Charity, we do need the Care Workers Charity. So where you want the things you want people to do to support you as a charity, and also the things that we as people in society could be doing to support care workers.
In terms of supporting the Care Workers Charity directly at the moment, we are 100% fundraising charity in a benevolent fund, and we try to make sure that as much as possible goes to care workers in terms of grants. You mentioned earlier very kindly our event on Monday, Brew Monday for Blue Monday, and that's just one of our events this year. Thank you, Sophie. We have a very full calendar of events this year that you can find on our website. It's all over our social media. There it is. We're talking about walking, skydiving, and a fire walk even in April that people can choose from and sign up for to fundraise for us. I'm sure quite a few people have their own bucket list. There may be a bigger birthday coming up. And I think fundraising for us to take something off your bucket list, like a skydive or like a fire walk or a long walk, would be a great way to fundraise for us. We also signed up for different marathons, half marathons happening around the country, and different runs. So people can look at spaces for that as well. And we were very lucky to get for next year, but we've got a space for London Marathon in the ballot. So actually we'll be doing some sort of competition or application process for that, because we know that many people would like to participate in the London Marathon. So there'll be an opportunity for that as well next year. Outside of supporting us with fundraising, we need people to speak to their MPs and write to their MPs about social care and the situation of care workers. There's a lot of information on our website. But also we need people to, when they talk about social care, not just talk about care workers as tools that deliver care, but human rights in their own being, that have their own needs, that should be paid properly, treated properly, should be able to have a break and go on holiday because of how hard they work. And not to forget about that. I think too often still I hear conversations about social care where the workforce is forgotten, And I just would like to remind people that without the workforce, we do not have social care. And the relationship between a care worker and the person who draws on social care is extremely important. And both people who draw on care and care workers need to have a very, very strong voice in terms of shaping the future of social care. And our intention is to have a meeting with our advisory board or champions group of care workers every month, to write briefings to politicians and stakeholders, and to make sure that care workers are heavily involved in any decision making that's going to be taking place about social care this year.
I think those are amazing activities, and I think it's really good advice for people to get involved and to contact your MPs and just really flood them with the concerns that people have about the sector and about how, you know, will you have a care home to send somebody that you love into, or will you be able to source home care, or if you know, anything happens to you, because we're all human beings, we've all got bones, and anything may happen to us, where we, even for a short period of time, we need that support. And it's just making sure that the sector is sustained and that the people who work in it are properly supported. So I definitely would say that's really important for people to get involved with, supporting the charity and supporting the sector. What did you think about the announcement about the review for social care, and that, you know, they're going to do an interim publication in next year, and in 2028, that's when they're going to, Louise Casey is going to report on the state of social care. I mean, she does an incredible report, so I'm really looking forward to it, but it's quite a long time. Do you feel that social care is being kicked down the road a little bit? The can's being kicked down the road. You've got a review on the NHS, I think, being published this year shortly, or a plan, NHS plan this year, but then social care has got to wait for its plan for another 3 years. Is it a bit worrying that our politicians don't seem to be taking it seriously? And then obviously combined with the fact that they don't understand what social care is, and it's not difficult. I mean, they can all read, so you can, and they're all engaging with people. And the Health and Social Care Select Committee, that's why I wanted to have Simon on, because he just spoke to them. They're doing a lot of research, but it seems to be Parliament after Parliament. That committee does a lot of reviews and there's a lot of reports. The government has a reply to the report, and then nothing else happens. So I don't know if you get kind of like political engagement fatigue. I don't know whether they're really serious about doing anything about social care or not. What's your impression?
My impression is that nothing will be done until, if, let's say, the Labour government gets in for another term. I think in this term of the government, we won't get much. Fair pay agreement may take a couple of years to happen, and then implementation may take time. So I think it's very difficult. I think part of it is not understanding social care. Part of it, I think, is being scared of social care, because I think it's generally perceived as politicians as the sword that they all fall on and die on, which is very worrying. Baroness Casey report findings and commission findings coming out in 2028. You know, that's a very long time away. And as much as I'm sure, you know, it will be a great report and a lot of important information, I also feel that we have a lot of great reports with a lot of great information available to us already. And it's very difficult to think what else is going to come up that hasn't been said in the last 5 years. For example, in the meetings that have been held, in the papers, green, white, whatever else color, that have been written. So we are worried at the care workers charity that the situation of care workers won't change, let's say, for 3-4 years. That's a very long time for care workers to continue on minimum wage, to continue without sick pay, to continue not being paid for at least some of the training that they do, etc. We are currently conducting our well-being survey of care workers. We've had 1,100 responses already, which is great, and we'll keep it open for a while longer. And quite a few questions there, I have to say, around 50, and they cover everything through financial, physical, mental health, well-being, and perceptions of the workforce. it will be interesting to see the results. I don't think we'll be surprised by the results of what comes out of that survey, but it will be good to see it in actual numbers and what care workers are saying. So yes, the announcements of the commission and how long things will take, even with the interim report, are quite worrying in terms of the timeframes of it.
Yeah, absolutely. And Mick put a really interesting, important question in the chat. Will anything be done until the sector starts to collapse? Which is really sad, because I almost feel like that's what the politicians are waiting for, in order to really do anything. They don't want the warnings, and they don't really sympathise or empathise with the difficulty of the care workers charity. Some do. I know that you've been lucky enough to hold an event in the House of Lords, and you have had people who have been really mindful and really understand the issues that the sector is facing, but the will just isn't there. So having people like yourselves try and highlight the issues is so important and absolutely invaluable. So really appreciate that. So I'm going to pop Polly in and have a little natter with her, and then let you go, Carolina. I might as well ask you this question, and let you go actually. What do you see? The question of the live stream is, will 2025 see the collapse of social care, the end of social care? So obviously it's very clickbaity, bit dramatic, but you know, for some people it will be the end if some providers can't sustain their businesses on with the increases in NI and not enough to support them to meet those increases. And obviously there's other costs, like, you know, training, and some people do want to give more well-being support. And I know that the Care Workers Charity supports local authorities and organisations to manage their well-being as well, funds. So do you think that the care sector will be able to survive this, or what will the ultimate challenge be for this year?
I think you're right. I was at the launch of the report by HFT and Care England the other day this week, in terms of the state of the sector. And from their survey, you could clearly see there are quite a few providers that were saying, you know, they're just about to close business, or they've had to close parts of their services because of different things. But I think if you add on to it the announcement about the national insurance contributions, that makes things even worse, especially for SMEs. I don't think the sector is going to collapse in 2025, because and that is actually a problem, because there is an incredible resilience in the workforce and in the sector altogether, because people push through, make huge sacrifices, and do a lot just to make sure that the people that need support get that support they need. And that has forever been taken advantage of, like I say, you know, through pandemic, beforehand, and care workers are always pushed beyond what they should be doing. But I think people are really starting to lose patience around the inaction around social care. And I'm not sure that the announcement of the commission is enough, and the busy work that we're being given with the commission is enough to keep people satisfied that action is being taken. So yes, I'm hopeful that some good things will come out of the fair pay agreement, the new employment right bill, and the commission. Forever concerned about timeframes of things. But I think the biggest concern is how much further can we push care workers, care managers, etc., social care in the state, and the level of funding that it's being given.
Yeah, that's really interesting. I definitely agree with you. And the employment right bill as well. I haven't caught up with all of that, but we're going to have somebody on to talk about that as well, because I think that's going to really create some challenges, extra challenges, because we don't have enough to the sector. So there we are. Okay, thank you so much, Carolina. I really, really appreciate you coming on. And again, everyone, please do engage with her. I will let you go. So thanks for joining us today, and I'll bring in Polly. We do have Simon. You popped in, Simon. Shall I try you one more time? I'll give it another go. Polly, if you could just hang on with us a second.
Yeah, good morning. Can you hear me?
I
Good
can hear
afternoon, rather.
you.
Can you hear me? I know, it's very exciting. I have been listening to you on YouTube, but I thought I'd give it one more go to try and get into the studio, and miraculously, I'm able to hear you.
Very exciting. I think for some reason I'm going to put you on mute myself. There we are. Because there's a bit of feedback. StreamYard, I think, is doing something funky at the moment because we've had a few troubles. But anyway, I'm not going to knock it because you're here and we can hear and we can see you, and this is so exciting. So what I will do then, before it goes wrong again, I'm going to let you, I think probably a lot of people do know you anyway, but introduce yourself and just go into, I know that the King's Fund, of course, that's what you do, is a lot of research in the sector. And you're fresh from coming from the Health and the Social Care Select Committee and giving evidence there. I haven't had a chance to catch up on that, but I think that was focusing on CQC. So there's a lot going on, but I'll give you a chance to summarize maybe the top few things, challenges that you've seen through your research that's coming down the line in 2025 for the care sector.
Yeah, thanks. So, I'm the senior fellow in social care at the King's Fund, which means I lead our work on adult social care. And yeah, we do quite a lot of research looking at particularly the sort of trends in social care. So in about 3 or 4 weeks, we'll publish our Social Care 360 report, which puts together all the data going back to 2015-16 and now includes the data for 2023-24. And I think those trends are really interesting, and they flag some of the challenges that will exist next year. Because when you go back and you look at the long-term trends, what you see is that really clear trend that since the introduction of the statutory minimum wage, providers' costs have been going up by more than inflation every year. And they've actually been fairly successful in getting those costs met by local authorities. I know providers often don't feel that, but nonetheless, that's what the data shows. But then what local authorities do, because they're paying out that money and they're spending a lot more money on adult social care than they were in 10 years ago, and in order to balance the books, local authorities cut the number of people who are provided with support. And in the last couple of years, we saw a bit of a change. We started to see fees still going up, but actually more people being supported. And the real concern, I think, next year is that, yes, there's clearly a threat to the provider market from that double whammy of the minimum wage increases and the national insurance increases. But in addition but the real concern, I think, is the additional concern is that local authorities will try and meet those extra costs because they've got a statutory duty to keep a care market in the areas where they provide services. But what they'll then do is they'll have to ration care, so they'll reduce the number of people that receive support again. So we'll go back to that cycle. So to me, that'll be the thing to look out for this year. It's not a pretty picture, I think it's fair to say, and it is something that, as I said, we've seen pretty much every year for the last decade, and there's a concern that that's exactly the trend that we're going back to.
Absolutely. I reckon that some people will challenge your statement about local authorities meeting the costs. I'm glad that you pointed out that they have a duty to do that, but anybody who works with local authorities, put in the chat, in the comments, do you think they're going to meet it? Because I just from what I've been hearing, I don't feel like providers are confident that they'll meet those costs. And I suppose they run the risk of going bankrupt if they do in some cases, because if it's more than the social care that they have on their bottom line, but it is often the biggest the biggest line on their accounts is the social care cost. I'll just bring up a question here from Mick, who's saying the social care sector has been predicting its own demise year on year for a while now. Do we have any insights about, is it able to keep going financially with actual year on year increases in costs? I don't know whether that's something that you can comment on, or people maybe have to wait until your report comes out.
No, I mean, it's the point I was trying to make, really, is that the reason the sector continues to go on, to survive, is that local authorities have actually been spending more and more on providing on the fees that they pay providers to provide care. And I know that doesn't feel like that as your provider. Bear in mind, well, of course, that's a national average. So in some areas, people will be doing a lot better than in other areas. But that's what the data shows, and that's why we still have a care market. And in a way, it would be a really odd thing, wouldn't it, if actually if local authorities didn't do that, if they had the money, and the evidence shows is that they have had the money, they've to just about get away with providing those fees. But then what they do is they reduce the number of people that they provide support to. That's how they balance the books. That's why we still have a provider market, albeit a very squeezed and unhappy one, that knows that it's not being paid enough to provide the quality of care that it wants to provide.
Do you think then, with that data, just mute you a second. If you are a policymaker and you're looking at that data and you're thinking, I've got all these different costs, and it's a very difficult time for the UK in general in terms of budgets and costs and borrowing costs and whatnot. And obviously there's some issues with social care, but it's year on year, it's survived. So therefore, it will be the same going forward. So it's very difficult, even when the sector and people in the sector are saying, care workers aren't paid enough, and it's not right socially that we are in this position. But effectively, it's still going to cope. It's going to find a way to cope in some form. It may be that some people don't get the support that they need. It may be that some care businesses go out of business because they can't quite meet the cost, but there will be some kind of provision. And it's almost like what Carolina was saying, you almost need to see the failure for that to come through in the data in order to then justify doing more for the sector. Oops, sorry, I've muted you. Let me unmute you. So like a second. Yeah, okay.
So I think we need to be making the case for why we need investment in social care, so we're not just bumping along the bottom, which is what's happening at the moment. So it's about, why do we need what difference does a really genuinely stable provider market, as opposed to one that is consistently worried about coming in and out, being able to survive. So things like care deserts. If you look at where care homes are tending to be built, they're tending to be built in areas where there are large numbers of self-funders, simply because providers can charge self-funders more and they can balance their books that way. But that also means there's a risk that if you're living in an area without self-funders, you may struggle to find the care homes that you need. So it's things like that where the market is not working, and where that sort of minimal level of funding isn't providing what's needed. And you only have to look at the report today and you see that about corridor care in the NHS, part of the response to that has to be, well, we need to stop people needing to go to A&E in the first place. We need to invest in prevention. But actually, if you're not going to put money in, if all you're going to do is just pay enough to prevent the market from falling over, then you're not going to get the investment in prevention, investment in technology that you need to really ensure that social care can genuinely provide the level and type of support it needs and make a contribution right across society.
That's a really good point. And I like the way that you've brought in the idea that we are talking about AI. I think the Prime Minister was talking about AI in different areas, and we are talking about almost the periphery of what's needed in all sectors, but particularly in care. I know digital is a big thing, but actually we still need actual people and we need organisations to deliver the care. And I haven't read the report yet, but I think it's really interesting, your point around that almost postcode lottery that's probably going to become even more salient going forward, because of the way that care companies have to then provide care. If you've got presumably, if you're in more affluent areas, you're going to be able to have more self-funding people to go in care homes or to get home care into their own homes. And that's where those organisations are going to establish. And even for home care organisations, you do benefit from providing support in an area where your spread of people that you are providing support to isn't geographically quite wide. So you're going to end up with that postcode lottery of a lot of places just not having the provision that they need for social care, and other places being able to access that provision. So that's really, really interesting. And of course, I've written about the corridor care as well. That's been popping up in the last few months. And funnily enough, you would expect it to happen more in the winter, but I think the first report that I saw about it was in the summer of last year. So that's really quite worrying. And in terms of, so you were also at the at Westminster at the Health and Social Care Select Committee. Can you talk a bit about what you were highlighting? Was that mainly to do with CQC, and do you see a role for CQC in either highlighting, because they also do a lot of reports and data collection, obviously they're in a lot of trouble at the moment with their organisation, but do you see a role for them, because they obviously have that statutory duty as well in supporting or highlighting the issues of the sector? Okay.
Yeah, in fact, the session I was attending was much broader than that. It was basically part of the Health and Care Committee's inquiry into what's the cost of not investing in adult social care. So I was on with, amongst other people, Andrew Dilnott, who obviously has quite a lot to say, and Catherine Smith from Sky. I think the angle that they're taking is quite interesting. What they're looking is, how do you make a case to Treasury that not investing is actually costing you more money than investing? And I think that's a good angle to take, and a really interesting angle to get, because first of all, for me, it gets you into what you're really asking. Well, what's the value of social care? What's it actually providing? And ideally, how do you, for the Treasury, how do you monetize that? How do you actually how do you quantify it so that it actually makes sense to people who are looking at, what's the value of investment in financial terms? But I think what we were all saying as well is that if you're looking for an equation which says that an investment in social care of £1 is going to generate more savings to the NHS or elsewhere than it costs, you'll struggle, because the work to date suggests that it's really hard to evidence that case. The likelihood is that investment in social care benefits a broad range of organisations within society, and a broad range of individuals. So simply looking for one measure of value, one measure of benefit, you will really struggle with. So we were saying, there is a really strong moral case here as well. Ultimately, the reason that we need to invest in social care is, in addition to the economic benefits and in addition to the savings that it might make, we make it because it's the right thing to do. It's just not okay that we live in a society where lots of people who have a need for support and a need for care actually don't have that care and support, and so they lack the independence that they're entitled to, they lack the quality of life that they're entitled to. And as a society, we ought to sort that out. We ought to do something about that, and that's a moral case that you have to make, I think, alongside the economic case.
Thank you for that. And I absolutely agree with you. I think a lot of people would. Actually, if anyone listening does agree with that, can you just give a thumbs up wherever you're watching this? Because I think that's just an important point to stress. So you don't think that, because a lot of people try and dig into the statistics around having more social care means you can stop people being in hospital when they don't need to be in hospital. You can allow people to recover better, and that frees up that NHS system. Do you think that if you can get clear numbers on that would be the one that the Treasury would listen to? We have to go round the route of NHS, because that seems to be the winner in terms of what the government tends to focus on, rather than the moral argument, which I think is a good one and I think is the one, but doesn't tend to get traction?
I think you need to use not just one argument. There certainly is an economic case to be made about the effect that it has, the infrastructure, the social infrastructure that it provides to society and the economy. You can certainly make that, and you can make an argument about savings. It clearly will generate some savings. I think the point I'm trying to make is you have to make the moral argument as well, because it may not stack up. The numbers may not stack up if you're simply making the economic and the cost-saving arguments, and the truth is today they haven't stacked up from the point of view of the Treasury. So either we're not doing a great job at making the case, and I'm not sure that necessarily is the case, or it's the numbers just aren't quite right. What may change things, you were asking, is I think client level data. So the way that we're starting to collect data about people who use social care and be able to link it to an NHS number starts to give you the potential to look at groups of people who are receiving, let's say, home care, and then you can look at, well, what's the impact on them in terms of the usage of the general practice? What's the impact on their use of accident and emergency, on the use of NHS community services? And we haven't got really strong data in that area at the moment, and the data that's now being collected will start to give us that data, and that could be a game changer. It can change it if it says the right things.
That is really interesting, and I hope a lot of people are listening. So we need to just collect the data slightly differently and look at the whole system, the effects, not just on the NHS. I love the fact that you mentioned about GPs, because even the stuff that we've looked into, GPs and pharmacies, again, parts of the system that people don't necessarily talk about, but they really do work together. If you think about the journey that someone has through the health and social care system when they need support, all of those people are engaged, and what effect does it have if we don't have a social care that's functioning well? What does that have on them and the whole system, and also on budgets and finances for the country? So that very interesting. I'm so glad we managed to get you on, Simon. I am going to move over to Polly. I'm asking everyone what they think. Obviously, I did have the main question was, will 2025 see the end of social care? Your final thoughts on that?
No. Clearly, social care will still be going in next year. There's not going to be a sudden collapse. The risk is that it's just a constant erosion of the quality of care and the numbers of people that are entitled to receive it. It's that constant erosion that I think we need to worry about more than the sudden collapse.
Excellent. So constant erosion, that's a good way to think about it. Thank you so much, Simon, and thank you for all the work that you do at the King's Fund. I'm so happy and grateful that the King's Fund is taking a real interest in social care and has been for the last few years. As much data and reports as we can get is just fantastic. So thank you for that, and thank you all your colleagues as well. And hopefully we'll see you again soon. Okay, take care. Okay, really excited now to bring Polly in. Thank you for your patience. Sorry, these live streams don't always go as planned, but really excited to have you here. And I'm hoping now, after we've been a bit doom and gloom, we've started very doom and gloomy, we've got a little bit more positive with Simon. And now we're going to turn to you. And I know you've worked a lot with organisations in terms of growth and supporting their workforce. Obviously, it's going to be a difficult time for the workforce and social care. And you work with a range of different industries and business leaders. And I always find that really inspiring to come out of the kind of social care space and see how people are doing things in other industries as well. So it'd be great to learn a little bit about what you do in a bit more detail, and also maybe some tips and things that people can start thinking about for 2025 when they have a potentially financially testing year.
Yeah. So I work both one-to-one with business leaders as a coach, and I also run kind of team workshops and learning and development programs around management skills and leadership confidence, improving communication. And it all comes back to building better places to work where people are happy and engaged. You know, we spend most of our waking hours at work, and people's expectations of work, what they want to get out of work, are changing. The economic state in the country at the moment and the ongoing cost of living crisis means that people are under, you know, ongoing pressures financially. And I think, going back to what Carolina was talking about at the beginning, that idea that if people are losing sleep at night because they don't know how they're going to pay their bills or cover their rent or whatever it is, they're not going to be able to bring their best selves to work. But that puts businesses in a conundrum when other costs are continually rising as well. So how do they balance giving that financial security to people that they need first and foremost? If you're familiar with the idea of Maslow's hierarchy of needs, that ability to put a roof over your head and food in your family's mouths, that's the number one thing. So if people are feeling insecure about that, then they can't show up their best at work. But then when you're moving up that hierarchy of needs, what else can we do to support people and reward them, acknowledge them, make them feel valued in what is clearly really challenging work that carers do, and often I imagine quite lonely when you're out and about. So yeah, interested to think about how employers are looking after people, and how, when the sector feels under so much pressure, you know, how do you give that security to people? And people are probably feeling threatened that their jobs may not be secure, things like that.
Yeah, I think the sector hasn't really felt it yet. It's still really, really early days, but I'm interested in those strategies that people can use when there isn't a lot of extra funding. There used to be grants in the past around well-being and support that you can give to people, and some people do have their own EPAs, employment assistance programs. But I'm guessing if people are going to want to start cutting costs, that those might be some of the things that they do cut. What can providers do, people, managers who are leading a team where, say, if there are less care services, there's more pressure to take on care packages, there's a lot more stress. How can you use your time as a leader to really connect with your team when they are feeling stressed? How can you use maybe supervision sessions to really connect with people and make that a space where people feel listened to, when you don't have the advantages of, you know, expensive team meetings or, you know, outings that you might have done because you had extra money to do all that kind of stuff? What are the small, intimate conversations that you can have with people that can still make them feel valued?
I think it's important to make time to have those one-to-one and team conversations to get people together individually or collectively. Those don't always have to be formal meeting spaces. So, you know, one thing that I think often works quite well is, can you just walk around the block to buy a sandwich together at lunchtime? Sometimes it's those spontaneous, casual moments that kind of create that human connection and give people a chance to sort of be able to talk to you. I think it's also in how you communicate. So for me, one of the things that I'm really interested in is treating people as human beings, maintaining that real emotional human connection that is often gets forgotten about when we're under a lot of pressure. We forget to deal with people as individuals and really understand what's going on with them. So when you're interacting with your employees, whether it's one-to-one or in a group setting, how can you show real empathy and show that you care about them? And one of the ways of doing that is using active listening, so really tuning into what people are talking about. Another one is asking really open questions. So, you know, we tend to say, you know, in the general course of conversation, hi, how are you? The how are you is not really a question, it's a kind of greeting. But if you pause and say, how are you? What's going on for you at the moment? You know, how are things? And really pause, listen to the answer. That's a really important way of showing that you care about people individually and that they're valued and that you're taking their concerns on board. So that things like that, which sound really small but are really tangible in building those stronger connections with people, and then you can address any concerns that they might have, and treat them as individuals. So I think that that's one really key thing. I think a level of support and understanding around wellness and mental health. So whether it's sort of having some people in your organisation who are trained in mental health first aid to recognise first signs that people are struggling, or to have spaces and people available for someone to go and talk to when things are too much. Being able to signpost, even if you can't provide those resources within your organisation, being able to signpost people to places where they can get that support, whether it's kind of financial well-being and guidance, or whether it's mental health support of one sort or another. So having the resources there to signpost, even if you can't provide them in-house, I think is really key. And I think being with all the changes that are clearly going on in the sector and uncertainty with the report and the length of time that that's going to take to come out, and ongoing pressures with change to employment law and so on, I think it's really important for leaders to communicate really clearly, to be transparent, and I think it's okay to be vulnerable. I think sometimes leaders feel that they need to have all the answers all the time. And actually, I think, again, it comes back to being human. Sometimes it's okay to say, well, actually, I don't know the answer to this. This is what I do know. But, time will tell, so that people can, recognize that you are not invincible. I think that, again, that creates connection between people.
I think I want to just pause a bit on that invincibility and the idea of sharing as a leader and as a manager. I think those teams that are really tight and have that, it's a less of a hierarchy, and they have a bit more equality in terms of how they treat each other. So sometimes a manager, I've known managers who are quite open when they're having a bad day, and they'll just say, this is what's going on with me, because a lot of stuff gets funneled up to them, and sometimes they are having a bad day, and that humanizes them, and then it helps the staff team to say, right, okay, I know where we're at this point, and just being really open. And it's not a sign of weakness. I think it's actually a sign of strength. Obviously, you don't want to be having a bad day every day, all the time. That might be a problem. But, when you do have those instances when there's a lot going on, I think it's okay to, to share, not too much, but to an extent that they know where you're at. And then
I completely agree. And it role models that behavior as well, because if you're able to do that yourself on occasion, it makes people feel safe that they can also share. I'm having a bad day. I didn't sleep last night because, whatever it is. So it sets an example that it's okay. And it builds empathy between, in the hierarchy and also across peers.
Yeah, absolutely. And I loads of ideas that you were sharing around, even if you just go you're getting a sandwich, just pick someone with you, take someone with you, have a chat, not always having a supervisions in the office. It can feel a little bit stiff and kind of like a contrived environment, but just having a bit more relaxed, you can really understand what's going on. Because like you say, if there's something going on with them, it might be to do with work, the situation you need to sort out, and also it can reflect in their quality of care that people are providing. Yeah. So it's like better the devil you know, and then you can support people. And also the idea of signposting, that's one thing I think is good for organizations. And even is making me think, I need to have a list of organizations to signpost people to. We do have some, but can we dig deeper? Can we look at drug and alcohol support? Can we look at domestic abuse support, because not everyone's not always going to want to open up about everything, and it might be something that's happening to somebody that they know that's affecting them, and that it's useful to have that at hand that you can share, even if you don't have the resources to help someone directly. So that's really helpful. I am conscious of time, but I also know that we did come to you late. But are you able to share any other tips at this point? If you have to go, that's obviously no obligation.
It's fine. Another thing that I was thinking about is how we use technology. So, there's a lot of talk at the moment about how the way that we're working and increasingly using technology is is taking the human relationship out of management and work. And I think that's true too. But I also think it's useful to think about what technology can you use that will that can improve communications and also free up routine tasks so that people can focus on doing what they're there to do. The caring is obviously, you're never going to replace a carer with technology, but are there systems that you can put in place around record keeping or reporting back that can be done, that technology can improve and make easier, so that people can spend more time doing the important part of their work, and how you use it to communicate across teams, but also I think to do that in a mindful way. So a lot of teams that I work with, when they're working shifts and they don't necessarily see each other, there is a tendency to use things like WhatsApp groups to kind of communicate as a team. And I think it's important for leaders to set some good boundaries around how you might use WhatsApp or Slack or Teams or whatever to communicate with people and allow people to know that, if it's their day off or they finish work, you can switch off notifications. You don't have to reply straight away. I hear back from a lot of people that say, well, it's my day off, but I'm using WhatsApp to communicate with my friends, so I can't help seeing a message there that something's happened, and that makes it harder for people to switch off from work. And I think so for leaders to kind of support people to set boundaries so that they can switch off and be mindful about how you use the channels like WhatsApp and Teams that are on when we've always got our phones on, so that kind of people can have that time to switch off.
I think that's a good idea.
And another thing is thinking about when finances are tight, how can you show that you value people and reward them beyond financial measures? So highlighting good behavior with things that maybe can sound a bit gimmicky, but like employee of the month, or making even, I think we too often forget to say thank you. We just kind of think this is your job and you're there to do it, so just get on with it. But it's important for managers to remember to thank the people that work for them. We wouldn't have a business if we didn't have the people in the team. So sometimes a small thank you, a small acknowledgement, one-to-one or, in front of others, can really give people a boost. And giving people feedback, saying, yeah, you did that brilliantly, it really gives people a lift.
Do you know what it made me think, actually, as you're speaking? I almost feel like sometimes we need to give managers, or have as managers ourselves, a bit of a checklist of the things that we need to discuss. And how sometimes a lot of people don't like this, but you might have like a sandwich conversation when you've got some constructive criticism to give. So you'll just say that something positive, give the constructive criticism, and then something positive to end with. Wouldn't it be good if each manager, each team meeting, did that kind of format and called out people who were doing some really good work in the team meeting? Because there's so much going on, and obviously you're dealing with people with high needs potentially, and you might have to talk about training or medication errors or something, an incident. So there's a lot to cover, and then you can leave feeling a little bit like deflated. But maybe if you just had in every team meeting a member of staff that did really well, that you just want to, like you say, call out in front of others. And that gives you a warm, fuzzy feeling. And then you deal with all the issues, and maybe at the end of it, end with something positive. I never thought of something like that, but just speaking to you there just made me think of that.
Yeah, I'm quite a fan of a format for team meetings around and more informal sort of starting off with highlights, headaches and horizons. So getting everyone to share something really good that's happened since you last met, something that you're feeling good about, celebrating that success. Exactly. I think you've got hit on something really important there. Remembering to celebrate what's gone well. Headaches might be things that are concerns, problems, issues that have come up. And almost the idea, if you do that at the beginning of the meeting, you get them out and you put them on the agenda or you add them to another meeting. This is something that needs addressing. It's not necessarily just to have a moan. And horizons, what's coming up? What am I working on this week? What might I need help with? What do you need to know that I'm going to be here or there? That kind of what's coming up ahead. So I think that's quite a nice, really informal framework for that kind of team communication.
I think that's so helpful, and I think I'm going to recommend that to our teams as well. And it's really easy to remember.
Yeah.
So I have really enjoyed our conversation, even though it's only been sort of like 15-20 minutes long. I feel like I can make a lot of notes and things that I want to do differently from just talking to you for a little while. You're like me, you're based in Bristol.
I am based in Bristol.
You can work for and support companies, organizations anywhere. How can people get in touch with you?
So you can reach me on LinkedIn. It's Polly Robinson, or my website is Growth Space, so growth-space.co.uk. And I'd be really happy to chat to anyone about any particular needs. I'm working with a lot of organisations at the moment that are dealing with issues around team cohesion, collaboration, conflict management, things like that. So yes, please do get in touch with me either via LinkedIn or my website.
Just a very quick question on the conflict management. Do you feel, I mean, there may not be a trend, but do you feel that sometimes when there is conflict management, it's because there's not enough preventative issues that have been done? So you haven't done those kind of like team bonding, listening to the team beforehand. You've kind of just let it bubble along or not taken it seriously or being too busy, and then suddenly it blows up. Like they're all things that could have been solved earlier on. Yes,
I do. I think sometimes we either too busy or too scared to deal with conflict in the moment, and then it snowballs, it escalates, and so it's about dealing with things in the moment, at the right time and the right place. And again, I think it's when people feel that they can't bring their whole authentic self to work, and then you start, you're not showing up as your best person, you're hiding a part of yourself, and you're taking home resentments, you're moaning to your friends or your partner rather than maybe going to your manager and saying, I've got this issue and we need to deal with it. So looking at ways to, one, to resolve it once it has reached that escalation point, but also helping, some of the work that I do is around helping managers to build the confidence to deal with it in the moment, so that it doesn't reach boiling point.
Right, excellent. That's so interesting. Thank you so much, Polly. I always love talking to you.
Yeah,
take care, and thank you so much for holding on for us.
No worries. Thank you. Bye.
Bye. Okay, that was great. So we're way over time. Timing is not my strong point. I'm going to bring Dayan in because we want to talk a little bit about the Each One Teach One. We haven't really decided what we're talking about, but we're just going to talk. So just a little bit of a reflection. What do you do? Obviously, we're both working co-produced care. We're both going to be working on Each One Teach One. Just introducing you a little bit there.
Thank you.
What are your reflections on some of the things people have said? Obviously, we've had such a broad spectrum of people from different places on here. So there's no one single message as you like. Just from listening to it, any reflections, anything you agree with, disagreed with any of the speakers in particular?
No, I think I agreed with most of the things that people said. Far more educated than me anyway. So, but I think the main topics that came up from my point of view, from Simon and Carolina anyways, is that there's sort of three issues that social care face. It's there's the costs for providers and the pay for support care workers. There's the lack of understanding from politicians and wider society of social care, and then there's obviously the perception of what social care is as well. And I think I was just listening to them, and I popped into my head that maybe would a lot of those issues be solved if we actually did have proper integration of health and social care budgets and all. And I don't know the answer to that, but I just think that there is a lot of money in the system. It's just a lot of it is in health. And what Simon was saying about the issues around gathering data, and I appreciate he said that the data is coming. I think a lot of it is difficult to quantify the difference that the good social care sector or quality social care sector makes to the health of people long term. So I just think that a lot of the issues or the perceptions, etc., would go away if maybe it was just seen as part of the NHS. Rightly or wrongly, because people would disagree with that, I know, but and I'm not sure I agree with it, but I just think that it would solve a lot of problems, I think.
Well, it's interesting you say that, because a few people do argue that. And I was looking back at my interview with Andy Burnham back in 2021, and he was talking about the Labour's plans for National Care Service. And his argument was, of course, some people think that would be a bad thing, but if you think about it, actually the NHS could benefit a lot from social care. It's not like the NHS is an amazing organisation that's going to give social care a hand up. Actually, the NHS can learn from the way that social care is very client focused and a bit more holistic, and actually it can change the cultures of how the NHS runs. I think that's very optimistic, but it's interesting. I mean, there needs to be some kind of solution. There needs to be some kind of support that needs to be properly thought through. And maybe Baroness Casey, I think she'll just end up telling us what we already know in 3 years' time,
Yeah, I think 3 years is too long anyway. So I don't think we can wait for another Labour government as well, another term, because it's just far too late. So, and will they be in a stronger position than they are now with the majority they've got? I'm not convinced. So
no, we might have reform.
It doesn't matter what political party it is. It is, when the Conservatives tried to put something on their manifesto a few years ago, obviously got taken off straight away, didn't it? But after the backlash, so I think the only way forward really is to have one budget. I think that was my biggest disappointment with the ICBs being set up, was that it was still separate systems of money, and unless the money it follows the, whatever you do, you have to have money to do it. So whether people like it or not. So you can have all the goodwill in the world and people talking different departments or different sectors talking to each other. But if there's not one pool of budget, then there's always going to be quabbles about where the money should be spent.
Absolutely.
That's my 2 penny anyway,
Yeah, no, I think that's really helpful. I also think, quite depressingly, there almost needs to be an actual crisis in social care before it'll get real traction. So rather,
I think it's getting more traction now because it is becoming a crisis, isn't it? So I think 2025 is a concern, definitely from a funding point of view for providers, definitely for care workers as well. But I think we might be getting to a point where something has to be done. So time will tell. Time will tell.
But maybe some providers, they are going to fail, and hospitals are going to be more backed up. But I think what Simon said was really interesting, and I think it's important to take stock on that. And I think on Tuesday, Isaac said the same thing. We really need to hear and quantify the voices and the experiences of those who were being affected, because I think if we can get the real data on that will and appeal to the emotions of the suffering that people go through, that needs to be valued, that qualitative data, because actually I think government after government are okay with it not failing, because what happens when it fails? People just suffer in silence, and so they're not really hearing the issues or really recognizing it. Then they're not being asked to properly engage with it. So I think, if something like the King's Fund and others are really going to be engaging in people's experiences in that way, that may be, and we need to value that type of data. That may be a way through. We'll see. Let's talk about each one, teach one. So we'll play a little video at the end that explains it a little bit more, but we're going to be kickstarting with our first program of training support mentoring in March. So this is just a slide of the first session that's going to be held in March. So we are taking applications for the first cohort. So if you want to express an interest in the chat, you can just click on the link now if you're watching live or watching a bit later, and inquire into how you get onto that. And it's really exciting because we're going to be gathering all the tools and information that we've researched and got together as an organization, sharing that with people. It's for managers, team leaders, directors, really supporting those micro organizations who are within the community who are trying to grow their provision, but getting their head around it and need a bit of support, maybe don't have enough money to have like a HR department and a policy department. So we're going to try and really help build those tools for people to access and get them on their way. So do share with as many people as you think might find it useful. And it's exciting because part of the program, the 3-month program, it's CPD accredited, that we're starting in March, is going to be, sharing knowledge. We're going to have an expert speaker. So we're going to have someone, for example, on the employment workshop from a solicitor talking about employment law. And then we're also going to have peer-to-peer learning, because I don't know about you, but sometimes it's in those provider meetings that I learn some really important ways of working, because it's like tried and tested. So what are you excited about this new scheme that we're starting at Co-Produce Care?
Well, yeah, I think the main thing and the main reason I think we thought of it really was that we've grown our business. We've done things well, and we've done some things not so well. And as ideally, what we want to do is sort of pass on the things that have worked well in our organisation, so people can build up off that, and also learn from our mistakes so they don't make them themselves. And also provide that network of people that they can actually go to at any time through their journey, because it's quite a lonely place. We've been fortunate, because obviously we've both been doing it together. But many startups and small businesses they've got sort of one person at the helm trying to do everything, and that growth step is quite a big thing, and a very difficult thing. Having to manage other people, etc. So that's the hope. There's a lot of startups. Social care is going to be a challenging year, but it's also where there's challenges, there's also opportunities. So we'd love to sort of share our knowledge and be part of that with various organisations, hopefully, and people.
Yeah, and exactly. And I think that the whole reason why we thought this would be useful is because we've done a lot of pro bono work supporting community groups who want to provide more support in their area, whether it's people from the Somali community or whether it's people who have got a specific need and they've looked after someone in their family for a while and they feel that they can, start to do more of it themselves. There's a lot of how small organizations start, and they start employing people and just helping them understand and navigate the sector and where to go to for support. There's a lot of free support out there. There's a lot of resources there. CQC is a minefield, but we can support each other to get off the ground, especially if we might have to be relying on those type of community-based organizations more, if the larger ones are gonna, with their high overheads, are going to struggle a lot more with the increases in national insurance and the national minimum living wage. So I think what we're trying to do is create something that people can access with limited funds, but also share that invaluable knowledge that we wished we had right at the beginning. So hopefully people can join us in that journey. So that was really helpful to go through. I'm just going to, any last words, Dan? Otherwise I'll take you out and wrap up.
No, just maybe put the Eventbrite up, and hopefully people sign up. It'd be really good to have a good cohort to start off with, and then obviously we'll build from that. So excited to work with various organisations and people going forward.
Absolutely. Thank you. Okay. So say goodbye to you, and I'm just going to move on to talk about what's coming up next with Co-Produce Care. What I would say to people is, because we're a super duper small team, we are not doing these live streams regularly. It's not like some people go do it every week at on a Tuesday at 12 o'clock. We are just doing them as and when we can get availability. So the best way, I do try and promote, being really organised with promoting on LinkedIn and with our network, but the best way to know when we go live with these type of things or to watch back afterwards is to like and subscribe to the YouTube, because that's always going to be there. That link will be there. You can go back to, you can dip in and out of, and you might be watching us on LinkedIn. Swap over to YouTube if you can, find us there. And then we've got about 120 videos. We've interviewed a lot of everyone from politicians to people doing different things in care to the World Health Organization, and we are going gung-ho this year again with more. I'm reaching out to politicians to find out their ideas of social care, but also I really need you on those live streams to ask questions to our elected officials. And as I engage with people and get more people interested, we'll just start doing those. So either sign up to our newsletter. You can find how to do that on our website. And you can also, or you can email us, but if you just click like and subscribe, and the bell if you're on YouTube, then you'll just get a notification. You can watch it back. And you can fast forward and go, because there's a lot of me rambling as well. So you can do that. But I can tell you, I'm in discussion. I have emailed a lot of politicians, Labour, Conservatives. I'm probably going to have Reform. They've come back to me quite sharpish. I'm going to have a representative from them on in February. So watch out for that. But most importantly, I'm going to be speaking to the organisers of Providers Unite. So that's going to be next Thursday. I'm going to sign off for a bit. I've got some deadlines and things I've got to do. But I'm going to be back again on Thursday, the 23rd of January. And we're going to be talking about their movement, their campaign. We've been pushing that quite a lot because I think I'm going to support any movement that tries to bring people's voices in social care, wherever they come in the sector, but they are really trying hard to bring people together and to really shout about the issue. So you can ask them questions, you can find out what they've got planned, you can find out how to get involved. So please do engage with us and keep track of what we're doing. But I think for now, I'm just going to thank everyone for coming on to the show today. And we very much look forward to seeing you again soon. Okay, bye everyone.